In the last few decades, obesity has been becoming more and more of a problem for countries around the world. Here in the UK, the problem has been more acute than others. So, how bad is the situation in the UK? What has caused the problems? What can the government do to fix it?
Is too fat and is getting fatter.
Damning figures today revealed that obesity costs British taxpayers almost £14 billion a year, twice as much as those of a healthy weight.
Hospital admissions linked to obesity have doubled to more than 3,000 people a day.
Before we start, if you haven't already, please consider subscribing and ringing the bell to stay in the loop and be notified when we release new videos. First, let's look at the numbers. In England, since 1993, the percentage of adults with obesity has basically doubled from 15 to 28 in 2019. Interestingly, over half of this increase occurred between 1993 and 2021. The picture looks similar for Wales, Scotland, and Northern Ireland. Although Wales and Northern Ireland generally have lower rates of obesity to England. The difference in who suffers the most from obesity in the UK is not just limited to region either. It appears that obesity rates are strongly linked to poverty, with almost 70% of people in the poorest areas being overweight or obese. By 2050, the figures are predicted to rise to 60% of men, 50% of women, and for children under the age of 16, an increase of 25%. Obesity isn't just a concern for adults. It is also rising among children. Recent reports by the NHS show that nearly 1 in every 5 children aged 10 to 11 are living with obesity, a figure that has more than doubled over the last 30 years. Childhood obesity rates are at 13% in the UK's most deprived areas.
So if you look at obesity in reception year, if you look at the highest and the lowest socioeconomic groups, at reception it would be people living with obesity would be a bit over 13% in the most deprived areas and about 6% in the least deprived.
The COVID-19 pandemic has had an impact on obesity rates as well. Even the former Prime Minister Boris Johnson was admitted to hospital with coronavirus.
When I went into ICU, when I was really ill, I was way overweight.
Being overweight can lead to many other diseases like heart disease, cancer, stroke, and type 2 diabetes, to name just a few. What is the NHS doing to try and treat and prevent obesity from becoming a life-threatening problem?
We launched the National Type 2 Diabetes Prevention Programme, the flagship prevention programme within the NHS. And we have very recently launched our digital weight management programme. It supports people through behaviour change to empower them to lose weight, exercise more and eat more healthily.
But even aside from the moral considerations here, there is evidence that this has further effects on the wider society. Obesity-related healthcare costs the NHS about £6.1 billion per year. And that's just for treating diseases linked to obesity, including type 2 diabetes, heart disease, and some cancers. In fact, the total societal costs of obesity have been estimated somewhere in the £29 billion to £58 billion range, which is roughly about 2 to 1% of GDP. Obesity doesn't just take a financial toll, it impacts lives in so many ways. People with obesity are more likely to face mental health struggles like depression and anxiety, and the stigma it can lead to bullying and mistreatment.
I lived with obesity all my life, even from early childhood. That's me and my daughter. You can see in that picture that I'm in pain. We'd gone to Euro Disney. She was running around the park, doing everything. I couldn't go on any rides. One of the things that upset me, the kids was shouting abuse at me about being large and fat. It was a horrible time.
So it's worth now turning to have a look at the factors that affect obesity in the UK, starting with why obesity is so heavily linked to deprivation. Now, obviously, one of the main links between obesity and deprivation is the cost of food. In the last few decades, the production of food has changed dramatically. Far more so-called superabundance foods that are high in fat, sugar, and salt are now available. The thing about these foods is that they're cheap. They're made with ingredients that have a long shelf life. So in essence, because they provide a lot of calories for very little money, they've become increasingly popular. In addition to this, more modern working and living patterns have increased the prevalence of snacking. Healthy foods, on the other hand, are more expensive. In essence, as the food industry struggles to sell healthy food, it becomes increasingly difficult for wider society to be healthy. So what's the government been doing about it? Well, the UK government has tried to tackle obesity since 1992 with a range of strategies. For example, under Tony Blair, ads for unhealthy food were banned during children's TV shows. Later, David Cameron's government introduced a sugar tax and calorie labeling in restaurants. Boris Johnson's government took it further with a ban on junk food ads before 9 p.m. and limits on food promotions. However, despite all these different obesity strategies, they have failed to make a significant impact, with obesity rates doubling since then. All in all, obesity is a serious issue in the UK and it affects poorer communities more. However, the government can take action, like setting clear goals and investing in more research to tackle the problem.